Howdy guys, Ziggy here, and we're gonna do some cataract surgery. Because why not?
Hello, and
Hi.
welcome to Surgery Squad's Cataract Surgery. I'm Dr. Susie, and I'll be guiding you through this procedure today.
Hi.
A cataract is a clouding of the lens inside the eye. The lens is located behind the pupil and focuses light on the retina. A cataract causes loss of vision that can't be corrected with glasses, contact lenses, or even LASIK, so it must be surgically removed. We're going to remove the clouded lens and replace it with a new one called an intraocular lens, or IOL. The surgery takes about an hour and can be done on an outpatient basis.
Okay.
Today, our patient is a 66-year-old woman who has noticed an increased blurriness in her vision, as well as decreased night vision. She saw her eye professional, and she detected cataracts and recommended her to us for surgery. Let's begin. First, we need to administer a relaxing sedative intravenously. This will make our patient drowsy, but not put her to sleep.
I just want to say that's not actually how you stick a needle in.
Just prior to surgery, additional drops of anesthetic are applied. We'll use a device called a speculum to hold the eye open wide during the procedure. Place the speculum for me, please. We begin the surgery with a small, painless initial side port incision. This is called a limbo-corneal incision. It's done by making a small cut in the limbus with a crescent knife. Next, we use the crescent knife to make a corneal tunnel into the anterior chamber of the eye. A thick, transparent viscoelastic fluid is injected to fill the space between the cataract and the delicate underside of the clear cornea in front of it.
Okay.
This is done to keep the cornea from collapsing during the procedure. Help me out and inject the fluid into our patient's eye.
I'm glad they put an anesthetic in, or this would hurt.
Now we need to make a 2.85 millimeter wide incision at the edge of the cornea for the cataract removal. This is done with an extremely thin diamond scalpel.
Oh, over there.
A bent needle is inserted into the incision and used to poke a hole into the clear sac that holds the lens with the cataract. The needle is dragged to cut a line in the sac.
Just ram it right in there.
With the incision made, we'll insert the forceps to grab the torn sac and tear a circle out of it.
This is actually kind of cool.
Now you will need to inject fluid into the incision to separate the lens from the capsule. This causes the lens capsule to float so that it can be rotated during the next step. We'll now perform phacoemulsification, or phaco. This is done by using ultrasound to break up the affected lens so it can be removed from the eye. To do this, we pulse and drag the device to cut across the cataracted lens. We repeat the phaco from the other direction to create 4 pieces. The phaco is then used to suction out the pieces of the old lens.
It sounds like when you get to the bottom of like your
remove the last
travel
remaining
bugs,
soft cataract
straws,
material
try to
out
get
of
the
the
last
eye,
little bit.
leaving behind the clear, empty lens capsule. When you're done, inject more viscoelastic fluid into the lens capsule to keep it from collapsing.
A lot of fluid we're putting into this
The
chick's eye.
flexible intraocular lens is rolled up for insertion by the assistant and placed in a soft tube. The IOL is now injected through a tube into the vacant lens capsule. A probe is used to spin the lens into place. The thick fluid we added to the eye will need to be removed, and any remaining microscopic cataract fragments should be rinsed out as well. The incisions in the eye are generally self-sealing. Very rarely that we need to add a suture to close the incision. In our patient's case, we don't need any sutures. The lens is now in place. Our patient will need someone to drive her home after cataract surgery, and she shouldn't drive until she's cleared at her follow-up appointment tomorrow. We'll prescribe medicated eye drops to use several times each day for a few weeks after the cataract surgery, and she'll need to wear a protective eye shield while sleeping or napping for about a week after surgery. A special pair of post-op sunglasses will also need to be worn to protect her eye from sunlight and other bright light as her eye recovers. You did a great job today, surgeon. While you're here, try your hand at one of our other surgeries here at surgerysquad.com.
We'll do some virtual dental crown surgery. Because why not? I'll put the link for this website down in the description below. This actually looks amazing.
Welcome to Surgery Squad's Virtual Dental Crown.
Hi.
I'm Dr. Jeff, and I'll be assisting you with this procedure today.
Hi, Jeff.
A dental crown is a tooth-shaped cap that is used not only to restore the strength and functionality of a tooth, but can also improve its overall appearance. Before we begin, let's review the types of crowns used in dentistry. First up, temporary crowns. Temporary crowns are placed over a patient's tooth while they wait for their permanent crown. They're usually prefabricated and made of plastic or stainless steel. A patient's permanent crown can be all metal, porcelain fused to metal, all porcelain, or all ceramic, each with their own advantages and disadvantages. Click on the different types of crowns to learn more about them. When you're ready to move on, click the Continue button. The metals that are used in all metal crowns include gold, palladium, nickel, or chromium alloys. While all metal crowns require less tooth structure to be removed and have increased durability, they don't have a tooth-colored appearance.
I had those at one point.
Unlike metal crowns, porcelain fused to metal crowns can be matched to the color of your teeth. Unfortunately, the underlying metal may show through at the gum line, and the porcelain could chip off over time.
Oh, that would be
All
great.
porcelain or all ceramic crowns have the closest appearance of a natural tooth and may be ideal for those with metal allergies. However, they have slightly less durability than porcelain fused to metal crowns, and, because they require more preparation, they can be a bit more expensive than other types of crowns.
I believe it.
Our patient came in today with a broken tooth, courtesy of a freak softball accident, and we get the rewarding task of placing a crown in. If you haven't noticed already, it's one of their lower front teeth, tooth 23. Let's review what we're going to do today. To begin, we'll numb the tooth, then shape it, take impressions for our dental lab, place a temporary crown, and determine the shade of the tooth. When our patient returns for their next appointment, we'll place their permanent crown. Now, let's put on our gloves and get down to business.
Okay.
First, place some topical numbing gel on the injection site. This will alleviate any pain or...
No, I didn't even bother to let him talk.
Now we need to inject the local anesthetic. After it has taken effect, the area around the tooth and the patient's lower lip should be numb for a few hours. Inject the local anesthetic into the patient's gums.
Yeesh.
Let's wait a few minutes to allow the anesthetic to set in. Now that the area has become completely numb, we can move on to preparing the tooth. To begin, we'll reduce the size of the tooth, cutting it away from the adjacent teeth. Go ahead, give it a try.
Almost sounds like a bad pop song.
It looks good, but we need to create a more tapered top to the tooth.
Oh, excuse
This
me.
will allow for a more comfortable and exact fit for both the temporary and permanent crowns.
We're cutting off most of this guy's teeth.
That'll do. Now that the tooth has been shaped, we'll need to take impressions of our patient's teeth. This is done by placing impression trays into the mouth and having the patient bite down on them. These trays are filled with a putty-like substance that is generally referred to as impression material. The impression material is used to create a plaster cast and is then sent to our dental lab, where a dental technician will make the patient's permanent crown. Go ahead and make the impressions of our patient's teeth. When you're done, I'll have my dental assistant create the plaster cast and send it to the lab, where the magic happens. Excellent
That was
work.
easy.
My dental assistant just informed me that our patient would like an all-porcelain crown on the tooth. So before we can finish up with them for the day, we need to determine the shade of porcelain that resembles their natural teeth. Can you handle this?
Sure. Let's do this one.
That looks like a match. The last item on today's agenda is to place the temporary crown. The temporary crowns that we use are prefabricated and made of plastic. I've already lined the inside of the crown with the temporary cement, so go ahead and place it on the prepared tooth.
Boop.
Since it's only a temporary crown, there are some guidelines our patient will need to be aware of before they go. They need to avoid sticky and hard foods. Try not to chew using the temporary crown, and steer clear of flossing on either side of the temporary crown. By flossing around the temporary crown, our patient may unintentionally pull the crown off the tooth. Well, we've done all we can do today. Our patient will need to come back in a week to have their permanent crown placed.
Do I have to wait? Okay, I was gonna say. 1 week later.
Welcome back. Our patient has returned and is ready to have their permanent crown put on. Begin by using the dental hemostat to remove the temporary crown that we placed on the tooth last week.
The what and the who now? Oh, tweezers. In other words.
Now use the Explorer to remove any excess temporary cement and debris. I've already checked the fit and color of the permanent crown, and everything seems great. I've applied cement on the inside of the crown, so it's ready for you to place.
When did you do that?
Perfect. After the cement has hardened, the dentist would check the fit of the crown again and the patient's bite to ensure that there are no issues. Luckily for our patient, you did a marvelous job. After placing the permanent crown, our patient may notice some mild sensitivity for the first hour. Their dentist will also offer them some post-case recommendations to follow before they leave. This includes waiting at least an hour before having anything to eat or drink, and waiting 24 hours before enjoying their favorite sticky or chewy foods. If our patient has any pain or sensitivity when they bite down, they should contact their dentist immediately. This may indicate that the crown is too high on the tooth and needs to be adjusted. Most dental crowns last anywhere between 5 and 15 years, depending on normal wear and tear, oral hygiene habits, and other behaviors, such as teeth grinding, chewing ice, or biting your fingernails. Well, I hope you've enjoyed placing a dental crown. Maybe you should consider a career in dentistry. While you're at it, check out other great surgeries here at surgerysquad.com.
We're going to do the virtual hair transplant because that looks fun.
Welcome to Surgery Squad's virtual hair transplant. I'm Dr. Susie, and
Hi
I'll be
again.
assisting you with this surgery today. A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site. Although hair transplantations are typically used to treat male pattern baldness and restore eyebrows, beard, or chest hair, they can also be used to fill in scars caused by accidents or surgery. Today we'll be using the strip harvesting method to treat our patient's male pattern baldness. Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but are not limited to, aspirin, ibuprofen, and antacids. Alcohol use and smoking before and after the surgery can also result in poor graft survival. To prepare our patient for the procedure, we'll need to first shampoo his hair with an antibacterial agent to help prevent any infection. I think you can handle that.
Getting it everywhere. Gonna empty the whole bottle on his head. Not gonna be anything left. Click and okay. Meh.
So fresh and clean. Thoroughly rinse the patient's hair and we're ready to get started.
This looks so weird. Why'd the sound go off? I wasn't done yet. There we go. Okay, now I think I can't see under here, so I'm just gonna like, that looks good enough.
The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
Oh, then. Nah. Oh shit, that was bad. Did you?
That looks good to me.
Oh, they went and fixed it anyway.
Let's prepare the donor site. We'll begin by trimming the patient's hair in that area. Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing.
Oh, I gotta start from over here. She just fixes it again. I'm just gonna be like, I'm not even gonna try it anymore. Continue.
Great job. Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
I want to give him a lot of discomfort. What's so wrong with that?
Great, he won't feel a thing. Now we'll need to remove the piece of scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process. Next, we remove the piece of scalp from the donor site. Make sure you have a good grip.
Oh, it looks so bad.
Once removed, we'll prepare the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
Do 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 do. I missed a stitch, but apparently that's okay. Oh, there's another one right there.
Great, let's get to some dissecting.
Oh, okay.
The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others.
Okay.
Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
It's already like sectioned. You see that?
Nice job! This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable.
I do.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions in the recipient site.
They look like freckles.
Perfect. With all of the incisions, it's getting a little messy there. Let's get that cleaned up.
Why does it somewhat look yellow? No, that looks good.
Much better. Use your tweezers to pick up and insert the hair grafts into the recipient area.
No, I had to pick up that one first. Burp. 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 Butter. Butter.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site. After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections.
Okay.
For up to a week after the procedure, the donor area may be sore and some numbness may be experienced as well. Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed. During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months. And that's hair transplant surgery. Why not try your surgical skills in another surgery here on SurgerySquad.com?
Okay, and I think that's where we stop. That was how to cook a turkey. That's a surgery. Okay. But anyway, I hope this was entertaining for you. It was surely something for me. Anyway, if you liked the video, hit the like button down below. Don't be afraid to subscribe. I enjoy having your subscribes. That sounded very desperate. Fuck it, I am desperate. Anyway, like the video down below. Don't be afraid to follow my Instagram, my Twitter. Tell me what you want me to do. I am grasping for straws here. Give me a name of a game. Ignore that. I am desperate. Anyway, thank you so much for watching. I need to go now. Bye.